Over 50, doctors recommend this to increase leg circulation fast. If you end the day with sock marks so deep they don't fade, ankles that feel like concrete, or calves that ache when you stand up, listen closely. This is not just cosmetic puffiness. Deep, persistent swelling, especially when pressure leaves a visible dent in the skin, pitting edema, is a vascular signal. Veins struggling to return blood and lymph to the heart, capillaries leaking fluid into the tissue, and electrolytes trapped inside cells. For many people over 50, those evening pounds of fluid are the result of venous stasis and weakened microcirculation, not laziness or salt alone. Doctors recommend a targeted nightly routine that works with your body's repair window during sleep to actively move fluid, reduce pooling, and support the integrity of veins, and you can start tonight. If you're over 50 and dealing with swelling, stay with me, and if this is speaking to you, tap subscribe so you don't miss the next video about foods that silently damage vascular health. Here's the short physiology. By day, gravity pulls blood and fluid toward your legs. Healthy calf muscles and competent vein valves squeeze that blood back up. With age, valve competence and calf pump efficiency decline, capillaries become more permeable, and electrolyte imbalances let cells hold on to water. The result is venous pooling, tissue edema, and chronic strain on the vein walls, the very processes that make legs heavy and swollen. That's why simple elevation or cutting salt, while helpful, often doesn't fix the nightly problem. You need a sequence that first mobilizes trapped fluid, then uses mechanical and biochemical support to escort it away and give your veins a chance to repair while you sleep. Doctors commonly recommend a 7-step nighttime protocol designed to do exactly that. Each step has a clear reason and timing to maximize overnight drainage and repair. Below, I'll walk you through each step, explain why it helps, give practical details you can do at home, and point out safety precautions so you use these strategies wisely. Step 1. The pre-sleep electrolyte flush. About 60 minutes before bedtime, take a magnesium citrate supplement that provides roughly 300 to 400 milligrams of elemental magnesium, combined with a small pinch of potassium bitartrate, cream of tartar. The goal here is a gentle cellular flush. Magnesium helps relax smooth muscle and support cellular processes that release intracellular water, while a modest potassium boost can assist cellular electrolyte balance so water shifts out of swollen tissues. Take magnesium citrate that clearly states the elemental magnesium amount on the label, and choose a dose in the 300 to 400 milligram range only if your provider agrees. If you usually take smaller amounts, stay at your usual dose and discuss any change with your clinician. Do not use this step if you have significant kidney disease, because both magnesium and potassium are cleared by the kidneys. Also, if you are taking medications that affect potassium, certain heart medications, ACE inhibitors, spironolactone, some diuretics, or are on prescription electrolyte-altering therapy, check with your provider before adding potassium bitartrate. The potassium here is a pinch, not a replacement for prescribed potassium. If you do take the pinch, dissolve it in a small glass of water and drink it about an hour before bed, so it begins working while you are still upright. Step 2. Contrast hydrotherapy for the calves and feet. This step is simple, inexpensive, and uncomfortable in the short term, but it triggers a physiological reflex that actively pushes blood out of the lower limbs. Prepare 2 basins or a single tub with 2 zones. 1 hot water you can tolerate for 3 minutes, not scalding, think warm to hot, and 1 cold water you can tolerate for 1 minute, cold but not ice for most people. Immerse feet and lower calves for 3 minutes in the hot water, then 1 minute in cold. Repeat that hot-cold cycle 3 times, finishing with a cold plunge. The alternating heat and cold stimulate the vascular hunting reflex and create strong shifts in blood flow that help dislodge pooled fluid. Breathe steadily during the transitions. The cold will be jarring but short. If you have peripheral arterial disease, severely diminished sensation as with advanced diabetic neuropathy, open wounds, or uncontrolled cardiac issues, avoid aggressive cold exposure and check with your clinician first. For most people over 50 with circulation complaints but without severe vascular disease, contrast baths are a low-cost way to mechanically encourage venous return. Step 3. Active legs up the wall ankle pump. After the baths, lie on your back and elevate your legs vertically, legs up the wall position, for 5 minutes while actively pumping the ankles. The movement is simple. Point your toes away from you, then flex them back toward you at a cadence of about 10 cycles per minute. Aim for 5 minutes total to give the calf muscle pump repeated contractions while gravity is now assisting venous drainage. The combination of elevation and active muscle pumping does more than passive elevation alone. It mechanically squeezes fluid out of the calf compartments into the thigh veins and up toward the heart. If lying flat with legs elevated is uncomfortable because of back pain, place a folded blanket under your lower back or raise the foot of the bed slightly until the position is tolerable. The key is repeated conscious ankle motion while elevated. That's what simulates the walking pump when you're stationary. Step 4. Targeted topical venotonic massage. After the active pumping, perform a gentle upward massage on the lower legs using a light carrier oil, about 1 tablespoon of olive oil, sweet almond oil, or fractionated coconut oil, with 5 drops of cypress essential oil and 5 drops of rosemary essential oil blended in. Rub upward toward the heart using long, slow strokes, focusing on the lower calf area and stopping below the knee. Avoid deep massage behind the knee where sensitive structures lie. The venotonic oils are not magic, but cypress and rosemary have been used historically to support venous tone and to increase comfort. The mechanical action of the massage itself improves lymphatic flow and helps move residual fluid. Patch test any essential oil on a small skin area first to rule out allergic reactions. Use gentle pressure. The goal is to stimulate flow, not to cause pain. If you have fragile skin or are on blood-thinning medications that increase bruising, check with your provider before performing vigorous massage. Step 5. Low-grade therapeutic compression for night only. After massage, put on a pair of low-grade compression socks in the 8 to 15 mm Hg range, the sort commonly sold as flight socks or mild OTC support hosiery. These give a gentle, graduated support that helps keep fluid from pooling as you get into bed. Do not sleep in high-grade prescription compression unless that's specifically directed by your physician. High-grade or improperly fitted compression stockings worn overnight can cause deep indentations and risk restricting flow or damaging skin in some people. Make sure the socks fit smoothly with sharp edges or bands that dig in. If you have severe arterial disease, neuropathy, or any doubt about fit, consult a clinician before using compression. Step 6. The 3-hour pre-sleep fluid cutoff. Stop drinking non-essential fluids roughly 3 hours before your planned bedtime. The rationale is simple. While you're upright, kidneys can process a portion of the day's excess volume. If you stop drinking and allow the kidneys time to process fluid before bed, you reduce the volume the venous system must manage while you're lying down and immobilized. This doesn't mean dehydration or ignoring thirst. Small sips to take your supplements are acceptable, but avoid large volumes that will sit in circulation and contribute to nighttime pooling. If you take medications at night that require water, time them with your clinician's guidance. Exceptions: if you have conditions that require frequent fluid intake, such as certain medications or electrolyte disorders, follow your clinician's instructions rather than a strict cutoff. Step 7. Nighttime venotonic supplementation. Take a physician-approved venotonic combo at bedtime to support overnight vascular repair. A commonly used approach is a standardized horse chestnut seed extract containing ASIN, for example, a product that provides around 300 milligrams of extract standardized to roughly 50 milligrams ASIN combined with pycnogenol, pine bark extract, at about 100 milligrams. These compounds have clinical data supporting reduction in leg swelling and improved microcirculation when used in standardized forms. The timing at night is intentional. While you sleep, your body shifts into repair and immune modulation, and giving these extracts before bed aligns their activity with that window. Important safety notes for supplements. Do not use horse chestnut extract if you are pregnant or breastfeeding unless cleared by a clinician. Horse chestnut and pycnogenol can interact with certain blood-thinning medications and other drugs, so if you are on anticoagulants, antiplatelet therapy, or have a clotting disorder, consult your prescriber before starting. If you have kidney disease, many supplements require special caution. Do not self-prescribe. Always choose high-quality, standardized extracts and follow the product label and your provider's guidance. Supplements are adjuncts. They support venous tone and capillary integrity, but are not a substitute for medical care when serious vascular disease is present. Putting the sequence together. Start about 60 minutes before bed with the magnesium citrate plus small pinch of potassium bitartrate, do the contrast baths, follow immediately with 5 minutes of legs up the wall ankle pumps, then the upward venotonic massage, put on your low-grade socks, ensure you've observed a 3-hour fluid cutoff, and take the standardized venotonics right before you lie down. It's a short, focused routine that doctors recommend because it combines internal biochemical nudges, external mechanical shifting, and evening posture changes that let your body actually evacuate fluid rather than simply redistribute it. Now, a few practical tips and common traps. First, avoid crossing your legs for long periods. Crossing kinks veins and increases pressure in the lower leg. Second, avoid sleeping in positions that compress the groin or kink the femoral vessels. If you're a side sleeper, use a body pillow to keep your legs stacked and hips aligned so circulation isn't pinched. Third, don't overhydrate late at night under the belief that more water will flush swelling. That usually backfires by increasing the circulating volume your veins must handle. Fourth, avoid tight bands or elastic hairline socks that leave deep marks. Those constrictions can concentrate pressure and worsen capillary leakage. Know the red flags. This protocol is appropriate for mild to moderate venous insufficiency and pitting edema that's chronic and stable. If you experience sudden, severe, or unilateral swelling, severe pain,
warmth, or redness in one leg, seek immediate medical attention because those are possible signs of deep vein thrombosis, DVT, which requires urgent evaluation. Also, if swelling is associated with chest pain, shortness of breath, or lightheadedness, call emergency services. Do not interpret the suggested routine as a treatment for suspected DVT. It is an adjunctive nightly protocol for symptomatic swelling, not an alternative to medical assessment and therapy. A couple more safety reminders. If you have kidney disease, heart failure, significant hypertension, are on blood thinners, or take medications that affect magnesium or potassium balance, talk with your clinician before starting the electrolyte flush or the nighttime supplement combination. If you have known peripheral arterial disease, especially with leg pain on exertion, discuss the contrast hydrotherapy and compression use with your vascular provider. And if you've been prescribed compression stockings by a physician, do not stop or change them without consulting that clinician. The guideline here is only that over-the-counter, low-grade 8 to 15 millimeters mercury socks are appropriate for night use in many people, while high-grade prescription compression generally should not be worn to bed unless your doctor has advised it. What can you expect? Many people notice measurable softness in the lower legs and smaller sock marks within a few nights to a couple of weeks when they consistently do the protocol, because it actively moves fluid and supports capillary repair. Venetonics like standardized horse chestnut and pycnogenol may reduce swelling over weeks of consistent use. Remember, improvements are likely and possible, not guaranteed. Underlying chronic venous insufficiency, long-standing valve damage, or severe structural vein disease may require medical procedures, and this protocol is meant as a doctor-recommended adjunct to help manage symptoms and support vascular health. If you try this tonight, a few last practical pointers. Measure how deep your sock marks are before starting so you can objectively track change. Take photos under the same lighting and time of day each week. If you choose supplements, pick standardized, tested products from reputable manufacturers and keep a list of ingredients to share with your clinician. If you're unsure about dosing, ask your prescriber or a pharmacist. These professionals can match supplement labels to appropriate elemental dosages and check for interactions with your medications.
In short, this doctors recommend is a deliberate 7-step evening ritual. A pre-sleep magnesium and small potassium flush, a brief but intentional contrast bath sequence, active ankle pumping while elevated, a targeted upward venotonic massage, low-grade night compression, a 3-hour fluid cutoff before bed, and a nighttime venotonic supplement such as standardized horse chestnut extract plus pycnogenol. Done together, these steps work with physiology rather than simply fighting symptoms, giving your legs the best chance to drain, recover, and wake up feeling lighter. Try this tonight and pay attention to how your legs feel in the morning. If you have any significant medical conditions, are on anticoagulants, have kidney disease, or notice any sudden or severe change in symptoms, contact your healthcare provider right away. If this video helped you and you want to go deeper, watch the next video where I explain the 3 everyday foods that silently damage vein elasticity and what to swap them with.